recording.
Hello, Canagran again. I'm Jill Charles, registered nurse and cannabis nurse consultant. I am a part owner of CannaWorks LLC, and it is our mission to educate people about the amazing healing properties of the cannabis plant. Recently, I've been thinking about mental health awareness and how many people want to try cannabinoid therapy for mental health issues. So today, in honor of the many sufferers, let's talk about anxiety. So anxiety is a natural human response to stress or perceived danger, a feeling of unease, worry or apprehension that can be caused by various life events and circumstances. But when it becomes persistent or overwhelming and interferes with daily life, it can become a problematic condition, potentially leading to an anxiety disorder. Now, feeling anxious is the normal part of life. Many people worry about things such as health, money, school, work or family. But anxiety disorders involve more than occasional worry or fear. For people with these disorders, anxiety does not go away. It is felt in many situations and it can get worse over time. Anxiety disorders are undertreated. Only 46% of those diagnosed receive treatment for this condition. Given costs and other barriers to treatment, many people turn to alternative ways to cope with anxiety, including using cannabis. Many people commonly report that using cannabis to effectively cope with anxiety has great effect. How common is anxiety? Based on diagnostic data from the National Comorbidity Study replication, an estimated 19.1% of US adults had an anxiety disorder in the past year. An estimated 31.1% of US adults experienced some kind of anxiety disorder at some time in their lives. And the prevalence of any anxiety disorder is higher in women than in men. There are several types of anxiety disorder. General anxiety disorder, or GAD. And GAD usually involves a persistent feeling of anxiety or dread that interferes with how you live your life. This is not the same as occasionally worrying about things or experiencing anxiety due to stressful events. And then we have panic disorder. People with a panic disorder can have sudden and repeated panic attacks of overwhelming anxiety and fear, a feeling of being out of control. A fear of death or impending doom can happen during a panic attack. An intense worry can occur about when the next panic attack will happen. People have a fear or want avoidance of places where panic attacks have occurred in the past. I'll talk about the physical manifestations of anxiety later, but panic attacks create a completely different set of symptoms, such as a pounding or racing heart, sweating, chills, trembling, difficulty breathing, weakness or dizziness, tingling or numbness of the hands, chest pain, stomach pain or nausea. So a lot of problems with panic disorders. And then we have social anxiety disorder. So this is also a common type of anxiety disorder. A person with social anxiety disorder feels symptoms of anxiety or fear in situations where they may be scrutinized, evaluated, or judged by others, such as speaking in public, meeting new people, dating, being on a job interview, answering a question in class, or even having to talk to a cashier in a store. Doing everyday things, such as eating or drinking in front of others or using a public restroom, may also cause anxiety or fear due to concerns about being humiliated, judged, or rejected. The fear that people with social anxiety disorder have in social situations is so intense that they feel it is beyond their control. For some people, this fear may get in the way of going to work, attending school, or doing everyday things. Now, when we talk about anxiety, I have to talk about the fight or flight mechanism. So the fight or flight response is an automatic physiological reaction to an event that is perceived as stressful or frightening. The perception of threat activates the sympathetic nervous system and triggers an acute stress response that prepares the body to fight or flee. Nowadays, most people lead exceedingly busy lives with little or no time for themselves. If the need for relaxation continues to be ignored, the body is existing in a continual near fight or flight mode, which is contributing to anxiety. So let's think about the endocannabinoid system and anxiety. So the endocannabinoid system is present in all brain regions that are important for the processing of anxiety, fear, and stress. And it has been identified as playing an important role in these responses. Recently, the mechanisms underlying the central role that cannabinoid signaling in the brain and body has in the control of stress, fear, and anxiety have begun to be discovered. Both for anxiety and fear memory processing, the endocannabinoid system is thought to ensure an appropriate reaction to stressful events and to serve as a regulatory buffer system for emotional responses. Endocannabinoids appear to modulate the stress and reward networks in the body, consisting of the endocannabinoid system, the dopamine system, and the hypothalamus. These networks establish the balance between distress and well-being. Okay, so I'm going to now talk about the physical manifestations of anxiety. And there are multiple physical manifestations of anxiety, often leading people to seek medical advice for a psychological problem. And sometimes the anxiety is overlooked or underdiagnosed. These include increased heart rate and blood pressure, increased respiratory rate, sweating, trembling, feeling weak or tired. People can have digestive issues, such as using the bathroom frequently. They can have sleeplessness, either having trouble falling asleep or having trouble staying asleep. People have feelings of restlessness and have trouble relaxing. There is difficulty concentrating, startling easily, tiring easily, or feeling tired all the time. People can have headaches, muscle aches, stomach aches, or unexplained pains. Some people have reported having a hard time swallowing. People develop twitching or tics. People feel irritable or on edge. They have feelings of lightheadedness or dizziness and sometimes feel out of breath. So let's look at some of the treatments available. As a cannabis consulting company, we understand that living with anxiety can be an ongoing challenge, with many saying that it significantly impacts their daily lives. Medical cannabis may be beneficial for anxiety disorders when traditional treatments have not been effective in reducing your symptoms. If you haven't found relief from first-time therapies, medical cannabis could be a viable option for you. We're here to support you in managing your condition and to explore whether medical cannabis is right for you. I will discuss how this amazing plant can help, but also know that we are committed to integrated care, realizing that with a lot of conditions, a multidisciplinary approach gets the best results. To this end, I will discuss all the strategies and therapies that may help you so that you can have a greater understanding of them and make the most appropriate informed decisions about your care. Self-help strategies include keeping physically active, avoiding alcohol and recreational drugs, quitting smoking and caffeine, making sleep a priority, trying to eat healthy foods, trying to identify triggers, keeping a journal, and also keeping up your personal socialization. Other people find altering mindset can help with anxiety. They consider alternatives to the situation that's causing the anxiety. Consider facing your fears so you can recognize your concerns are fleeting and your imagined outcome is not guaranteed, i.e. sometimes we make it worse than it is at times. Simplify your life so you can adapt to your situation easier and do not engage in avoidable causes of stress. Try not to go down the rabbit hole of worry and find a way to stop it. Develop a set of strategies to use when you're feeling anxious so you can cope in the moment, such as calling a friend, some physical exercise or breathing techniques. There are some emotion-focused strategies. These aim to change and deal with how we feel when confronted with stressors. Turning to others for emotional support. Looking at ways you have changed in a person in a good way. Changing your view about the stressor by looking at positive things that have come from it. Some people turn to meditation, prayer, or their spiritual beliefs. Then there are some solution-based strategies. These aim to change the reason for the stress, taking action to change the situation. Problem solving, such as concerted efforts to make changes to address the source of your anxiety. Making a plan of action to address the situation causing the anxiety. Logical analysis to identify multiple ways to change the situation and finding solutions if the first solution falls through. Unfortunately, there are also some dysfunctional strategies out there that you should be aware of. Some ineffective strategies that do not actually really help and should be avoided. So denial, or denying the existence of the event or a stressor, is not necessarily helpful. Taking sole responsibility and self-blaming using self-criticism is also not a helpful strategy. Avoidance strategies are not usually helpful either avoidance of the topic or avoidance of people that can help you. And then inappropriate emotional discharges, such as venting your emotions inappropriately, also not necessarily helpful. Okay, now we're going to look at some traditional pharmacological treatments. So benzodiazepines remain a mainstay in anxiety treatment. Meds such as Xanax, Klonopin, Valium, and Ativan. You've probably heard of those. In recent decades, they've largely replaced barbiturates due to safety issues, but they do come with some side effects such as drowsiness, irritability, dizziness, memory and attention problems, and some physical dependence. A newer class of drugs, selective serotonin reuptake inhibitors, known as SSRIs. These are used to treat chronic anxiety conditions. And these include some meds you may already have heard of: Celexa, Lexapro, Prozac, and Zoloft. Side effects for these medications include agitation, shakiness, indigestion, constipation or diarrhea, loss of appetite, weight loss, dizziness, blurred vision, and a dry mouth. Newer onto the market, some anticonvulsant medications are being trialed for the treatment of depression and anxiety. Side effects of these meds include dizziness, nausea and vomiting, mood changes, swollen arms and legs, blurred vision, dry mouth, unsteadiness, and disordered thinking. Some people refer to that as brain fog. Now I'm going to look at some other herbs that heal, because cannabis is not the only herb with healing properties. So let's look at a few other ones before we take a deeper dive into the role of cannabis and the treatment of anxiety. Chamomile is a common one, and research has shown that long-term use of chamomile significantly reduced moderate to severe symptoms of generalized anxiety disorder. Side effects in chamomile are very uncommon, but do include nausea, vomiting, and dizziness. There is valerian, used since the 2nd century for anxiety and insomnia. Also has some side effects: headache and dizziness, upset stomachs. Lavender, as we might know, creates a relaxing atmosphere, calms the body's fight or flight mechanism. And side effects of lavender include constipation, diarrhea, and headache. Passion flower is used for anxiety, insomnia, and some types of pain. Side effects include drowsiness and dizziness. Kava kava is known to have relaxing and mood-enhancing qualities. Side effects here again include stomach upset, dizziness, and drowsiness. So let's get to cannabis and anxiety. While a federal ban on cannabis currently restricts scientific and medical research, there are some studies that indicate potential benefits for those living with anxiety disorders. Interesting fact, over 60% of cannabis users report taking it for anxiety. A 2022 study out of Canada with over 7,000 patients, based on a general anxiety score, which is a tool psychiatrists use to measure degrees of anxiety. Anyway, they demonstrated the scores went down over time, with most noticeable decreases at 1 to 3 months, sustained over the 2 years the study continued. It also showed that men with the highest scores at baseline showed the most improvement. While cannabis may aid in treating anxiety, understanding the different types of anxiety disorders can help you and your healthcare provider determine the best approach to potentially managing symptoms with cannabis.
You're not standing in the middle.
All right.
So this is already 20 minutes long.
All right, we might take some of it out then.
But like, how close are you to being done?
Oh, it's got to be close now. Let me just go over this bit again then. Cannabis and anxiety, all right? If I wasn't in the right place.
Okay.
Okay, so let's look at cannabis and anxiety. While the federal ban on cannabis currently restricts scientific and medical research, there are some studies that indicate potential benefits for those living with anxiety disorders. Interesting fact, over 60% of cannabis users take it for anxiety. A 2022 study out of Canada with 7,000 patients, based on a general anxiety score, demonstrated the scores went down over time with the use of cannabinoids, with the most noticeable decreases at 1 to 3 months. But they were sustained over the 2 years that the study continued. This study also showed that men with the highest scores at baseline showed the most improvement. So while cannabis may aid in treating anxiety, understanding the different types of anxiety disorders can help you and your healthcare provider determine the best approach to potentially managing symptoms with cannabis. So let's talk about the cannabinoids specifically. And talking about THC, you have to be careful with THC and anxiety. THC reduces anxiety at low doses, but it can increase it at high doses. It also depends on which strain and what terpenes are in the product. Generally speaking, if you want to use THC, the best strains for anxiety would be indica dominant. A useful terpene for anxiety would include beta-caryophyllene. Dosing is also important, which is why you should book a consultation with a cannabis nurse consultant and engage in nurse coaching for the right product and to learn about microdosing. Now, thinking about CBD, CBD reduces anxiety in all doses, and this is likely to be the best option for those with anxiety disorders. The problem with CBD is that it is a large molecule, so therefore it is not always very bioavailable. That just means how easy it is for the body to use it. But there's some really good news with the advent of what is being called acidic cannabinoids. These include THCA, CBDA, CBGA.
Car.
Sorry?
There's a car. Do you not hear that?
I don't. Not when I'm focused on this, I'm sorry. I really don't.
Like very loud. So
all right, I'll start this one again. The problem with CBD is it is a large molecule, so therefore it is not always very bioavailable. That just means how easy it is for the body to use it. But there's some good news with the advent of acidic cannabinoids, such as THCA, CBDA and CBGA. The bioavailability has increased in these products and they are 4 times more effective. And research is showing excellent results for these products. I have to say it, and I will say it repeatedly, you must take these products regularly for them to work. Now, the ratio of CBD to THC is also a factor to be included when considering cannabis for specific anxiety disorders, as are personal factors like family history of psychiatric illness, concurrent treatments, or medications. Again, from a very recent 2024 research study out of Colorado, this did show that THC, even in the long term, did not increase anxiety and was actually helpful. But again, it showed that all CBD dominant forms of cannabis were associated with acute tension reduction. It also showed that CBD products may be able to relieve anxiety in the moment for adults who use them, and possibly also in the longer term, in a way that is meaningful and doesn't necessarily produce the same risks or harm as prescription medications. So to end, anxiety is a common affliction that can seriously affect quality of life. Many people get anxiety relief from cannabinoids, either as a monotherapy or in conjunction with other therapies. Without help, it's challenging to find the right product, dose or route to best meet your needs. If you would like a one-to-one guidance, book a nurse consultation or nurse coaching with us at cannaworksconsultants@gmail.com. Visit our webpage at cannaworksconsultants.com to learn more. Don't forget to like and subscribe to our page to keep up to date, and thank you for watching.